Following the joy of a new baby is often the disheartening reality that mom's body has gone through quite an ordeal. We talked with Dr. Robert Brueck of Associates in Cosmetic Surgery to ask about the mommy makeover.
Many women come in to see me after pregnancy just thrilled and overjoyed that they have a wonderful human being, a little boy or a little girl, that's going to bring immense joy to their home and to their family. But the consequences of that pregnancy and the delivery is that it plays havoc on a woman's body. And so there's a repeating theme, if you will, for women that come in to get mid-body rejuvenation or a mommy makeover following pregnancy. And usually the areas that are involved are the breasts and then the midsection, the abdomen, the stretch marks, the loose skin. And sometimes it creates a bit of friction in the home because the husband's there saying, honey, you don't need any surgery, you look fine the way you are, you just need to do more sit-ups. And the reality of it is, the truth is, that when a woman develops stretch marks, she can do 1,000 sit-ups a day, and that loose skin and those stretch marks are not going to go away. So what we do is we go ahead and we counsel women, and I like to give them their options. For example, with the breasts, some women may have very sagging breasts, we call it ptotic breasts, and they have to be lifted, and in many cases augmented and made larger. With regard to the abdomen, they may have unwanted areas of fat that may require liposuction. And then two, because of the excess skin, they may need a formal tummy tuck. And so we can do a combination of the things. Like when we talk about facial cosmetic surgery, just like when we talk about mommy makeover, I say we can do A, B, C, and D, B and D, C and D, whatever your druthers are. And I think it's important to understand that I listen to my patients and I listen to what bothers them. It's not what bothers me. The surgery is for you. And so what bothers you is what we're going to address, it's what we're going to talk about, and it's what we're going to try and correct.
Dr. Brueck told us about the areas of the body most commonly addressed in the mommy makeover.
I would say the number one area would be the tummy and the breasts. They're actually pretty much neck and neck. Most women after pregnancy will develop what we call hypoplasia of the breast. In other words, they maybe were a C cup, they've had a couple babies, they may be nursed or breastfed, and now they're an A or a B cup, and they've lost a lot of breast volume. That's where an implant, a gummy bear implant, comes in to restore a more normal volume. The second thing we see very, very commonly in women is after the pregnancy, they have that stretched out, stretch mark, stria, if you will, of the abdomen. And the only way to get rid of loose skin is to cut it away. I tell people you can't wish it away, you can't put creams or lotions or lasers. I wish we had a fountain where I could just dip you in the fountain, it comes out perfect. It doesn't happen. So loss of breast volume and breast tissue and stretch marks and loose skin on the abdomen. Those are the two most common things that I see in counseling women about mommy makeovers.
And how long does it all take?
Usually we can do most of these procedures, if not all of them, in one day. Many times I'll do a breast augmentation, I'll do a liposuction and a tummy tuck all in the same sitting and have the patient home for lunch. What I would do, for example, many cases women will come in their flanks, their posterior flanks, if you will, are too big. So we'll take the patient in the operating room, place them on their stomach, suction that area. We then put them back on their back. We prep their chest and their abdomen. Then the next thing I do is to do the breast augmentation. We then finish that part of the procedure, and then we turn our attention to the abdomen where we do the tummy tuck part. And it's not infrequent that I do all three of those procedures at the same time, assuming it's what the patient wants and the patient, feels comfortable doing it. But yeah, we do it quite a bit. We do it quite a bit. So we don't have to space it out, which means the patient has one recovery time, it's less expensive, and they get their wishes all at one time.